Have a hard stop. Good evening. Welcome to this American Desi Society meeting today. An important announcement that there will be a hard stop at 7 o'clock today. The program needs to be ended at 7 p.m. So please keep that in mind. I'm Dr. Dhiren Nanavati, and it is a great pleasure for me to introduce to you Dr. Deepak Srivastava. His accomplishments are so many that I may not be able to enumerate them all. But in summary, he's professor of internal medicine, sleep medicine, pulmonology, and critical care at UC Davis. And he is also teaching and affiliated with San Joaquin General Hospital, University of Pacific School of Pharmacy, St. George School of Medicine, and School of Osteopathic Medicine at Vallejo. He has multiple board certifications. He has been instrumental in keeping us updated about COVID throughout the COVID season. He gave us numerous talks on the subject and he kept us updated on regular basis. Today he's going to talk about long COVID, which is an important subject. We are lucky to have such a talented physician in our community. On behalf of American Desi Society, I would like to welcome Dr. Deepak Srivastava to give us a talk on long COVID. Thank you.
Thank you, Dhiren. Right. That was a very candid introduction. Let's jump into the subject matter. I just would like to start with a disclaimer that this is part of a community service on behalf of the American Desi Society, who sponsors this Your Health virtual show and our recording on for the YouTube. This is not medical advice. This is neither a consultation on anyone's personal problem. The speakers generally address the most common, most important, and most prevalent problems which is facing our community. So I would like to go over all the information which is out there. I have tried to keep I have tried to take every possible precaution to keep it authentic and referred these resources where I collected the information from. And I'll tell you why this has become very, very important at this time, starting today, or it will become very, very important as of September 30th. We'll spend 30 seconds on one of the slides. So we were hoping that we'll see the end of the pandemic very soon, but it appears that the pandemic may have changed the shape and the face of it and is still haunting us, at least 40-50% of us. I think this is just a underestimate of the numbers who suffer with a condition which is what's called the long COVID. It has been given many, many names, as you know, and most of the information that I'll share with you today is from the Center for Disease Control in Bethesda. So we get the authentic information which is approved and which is spread across the country for the public use. It is also called long COVID, post-acute COVID-19, post-acute COVID-19 syndrome, long-term effects of COVID-19, chronic COVID, long-haul COVID, late sequela of COVID, post-acute sequela of SARS-CoV-2 infection, etc. And people in different areas of the country, you will see these names mentioned in the literature, they all refer to the same thing. It's an umbrella term for so many things, as we will appreciate today. So what are these conditions? These conditions are the development of the new or the recurrent symptoms of what person has been feeling while they were infected with this COVID, whether they were sick or they were not sick with COVID. So in situations like this, after the recovery, what happens is that either they have recurring symptoms of COVID, they were perfectly healthy prior to that, or there is an unmasking of any pre-existing condition. So let's say somebody was prone to have asthma, but they never had asthma. They were never exposed in an environment where their asthma that they were supposed to have would manifest or become apparent. Well, COVID can do that. So unmasking of this pre-existing condition. And it occurs most of the time once the COVID itself is gone, and now the patient is either short of breath or they have other symptoms that we will get into details. It can go up to 12 weeks of recovery time. So most of us officially now are supposed to recover from COVID in 4 weeks, but the recovery time can continue for about 12 weeks. And then persistent illness can become more likely in those patients who have extended time from week 5 onwards to 12 weeks. CDC officially, as I said, uses 4-week time frame to emphasize, and what they emphasize from week 5 to 12 is the initial clinical evaluation. So your healthcare provider has to be very astute and maintain a low threshold to listen to what's going on with the person who has just recovered from the COVID, and not write it off that, oh, you will get better. This is the key time to focus on what we need to figure out, that is this person going to develop long COVID, and what we can do at this point to mitigate the long COVID infection. And then offer the supportive care during these initial 4 to 12 weeks. So what are some of the complicating post-COVID conditions? So somebody who has number of pre-COVID, pre-existing, I should say, comorbid conditions. Somebody has diabetes, somebody has hypertension, emphysema, COPD, asthma. There are some more than the others, so they all have their weightage. But if there are pre-existing conditions, then they can actually put you at higher risk for developing the long COVID. Physical conditioning at baseline. So somebody who is unable to exercise by habit or because of some disability or some medical condition. So at baseline, if they are deconditioned, so that's one thing. The second is if they have gone through a prolonged illness. So prolonged illness not necessarily has to be COVID. It could be something else. Somebody has congestive heart failure and they are admitted to the hospital, and then they were there for a longish time and now they are deconditioned. They are at risk for developing long COVID. And then depression, anxiety, social environment, economic stressors, everything tend to compromise our immune system. And those conditions, depending on the patient's socioeconomic status, family life, etc., financial situation during the pandemic, all perpetuate and lead to a high-risk situation where the person will develop the long COVID-like symptoms. So these are some of the very common risk factors, if you will see. So not necessarily you just have to have any disease in order to get the long COVID, but just the other things, as I mentioned, will be instrumental in the development of post-COVID. So here is this cartoon, again from CDC. About 20% of the adults ages 18 plus have a health condition that might be related to their previous COVID-19 illness. And these are, if you will look at this cartoon here, the brain, the heart, the lungs, the kidneys, musculoskeletal conditions, and blood vessels, including blood clots and vascular issues. So it affects the entire body. As we will continue to talk in the next many minutes about how it affects, even the subtle presentation could be really serious. And why I put word seriousness here is because we really do not know that what will happen to these conditions as we go forward in our life, and after 10 years or 15 years from now, what these conditions will evolve into. So it has become extremely important now that we need to talk and stay in contact with our healthcare providers, educate ourselves, and do things that will at least prepare us with a knowledge base so that we can avoid and mitigate some of these situations. So here is something verbatim from the CDC, and I'd like to quickly read it, although it's painful, highly worded, but there may be some wisdom to read this, and then slides will become easier. So CDC says as more persons are exposed to and infected by SARS-CoV-2, reports of patients who experience persistent symptoms or organ dysfunction after acute COVID-19 and develop post-COVID conditions have increased. So COVID-19 survivors have twice the risk for developing pulmonary embolism, which is a blood clot going from your blood vessel somewhere, mostly in the legs, to the lungs. Actually, it goes into the heart and blocks the one of the major blood vessel, which causes a lot of problems, or some other conditions. So since COVID affects us, it enters our body through the lungs. Lungs are the first target according to this. So 1 in 5, so which is 20% of survivors aged 18 to 64 years, and 1 in 4, so which is 25% survivors over 65, they experience at least one incident condition that might be attributable to previous COVID-19. So we have to look at the entire body. In last slide, we looked at all the organ systems are affected. So we have to pay a lot of attention, even if we were exposed to COVID, even we are in the middle of pandemic, even if the test has been negative, one can develop these conditions. And that's the point I was trying to make here. Implementation of COVID-19 preventive strategies as well as routine assessment for post-COVID conditions among persons who survive COVID-19 is critical to reducing the incidence and impact of COVID-19 conditions, particularly amongst the age over 65. So this is profound for the older group of people, but equally profound. There's not only 5%, if you really look at, there's only 5% difference between the 1 in 5 and 1 in 4. So everybody is at significant risk. Here is the map of United States, and this is as of August 2022, and you will see what is the distribution of the long COVID in the country. So red is about 40% or above, and yellow is 25% or less. Only few states are here on the East Coast, if you will look at Northeast, which are low incidence for whatever reason, but rest of the country is all colored with different percentages. So this has become a universal problem, at least well identified in United States. So what causes it? Do we fully understand? Well, not quite, and maybe yes. So let's talk about it. What is known? It could be organ damage from the acute phase infection. So one gets infected, gets a little fever, few symptoms, and some organ is damaged, and we may be aware of it, and we may not be aware of it. So complications from a dysregulated inflammatory state. We all know that the COVID-19 is an inflammatory disease. So when our immune system is completely dysregulated, it can cause multiple complications in terms of the autoimmune diseases and all that we will talk about it. It could be ongoing viral activity associated with an intrahost viral reservoir. That means the virus is still hiding in our body. We know a lot about it. People who had chickenpox in childhood, regardless of how old they are, they can still get complications because chickenpox virus hides in our nerve system. And it presents as, I'm sure you heard about shingles and things like that. People are at risk. In elderly, it can present like chickenpox pneumonia, which is fatal. So we know about chickenpox a lot more than what we know about COVID-19, but the pathology is similar, and virus has an ability to survive in our system in dormant state, where it can come up with acute infection at some point. Compromised autoimmunity, inadequate antibody response, it can set us up for so many things and problems. And then other potential causes that the disease itself can lead to. So there are multiple reasons that have been worked on, and we really don't know that what particular process is taking place in terms of development of long COVID syndrome. We already talked about how multiple organs are involved. And I want to just point out about these psychiatric illnesses that are following COVID-19 infection and have become part of the COVID-19 syndrome or long COVID. Some of the autoimmune conditions, at least I have seen a lot, and I'm sure people who are in internal medicine practice, they have, general practice, they have, and cardiologists. I have, at least at this time, a database of about 250 patients, just in a very small practice of people who are presenting with scarring on the lung, which is not going away. We call it lung fibrosis. But the cardiac inflammation, multisystem and inflammatory syndrome presents with a rash on the body, skin, and things like that. They are all very, very common and frequently seen. Lasting impact, again, the similar slide, but now this one shows more symptoms. So acute coronary disease, which is angina or heart attack, the heart failure, congestive heart failure, cardiac arrhythmias, palpitations, cough, shortness of breath, low oxygen saturation, renal problems, kidney failure, joint pain, muscle weakness, tiredness, fatigue, anemia. And then here is the mental health, anxiety, depression, sleep problems, mainly insomnia, and substance abuse. And substance abuse comes from a variety of reasons. One is the confinement during the lockdowns, etc. People have nothing to do, but also a lot of people use these substances, i.e. alcohol or other medications or drugs, to induce sleep because they cannot fall asleep, lower the anxiety level. And those maladaptive habits actually cause a lot more problems than help in terms of mental health. A nervous system, headaches, memory problems, smell problems, we all have heard about, at least, hopefully not experienced, and even stroke. Metabolic problems, including new onset of diabetes or uncontrolled cholesterol and its other subsidies, obesity, weight gain. And then we have these GI problems with all sorts of things. One can be constipated, diarrhea, irritable bowel, acid reflux. Now, if you will see, this is like a textbook of medicine here opened up again now in the context of COVID-19. So this is a very serious and difficult problem to handle. And that's why the specialist consultation, as we will see a few slides down later, becomes very, very important. And then loss of hair. Variety of rash on the skin are noted. Some are serious, others are not that serious. And as you notice the CDC slide back there, this is from University of Washington, WashU slide. But the blood clots have become a scary reality, especially for many of us who go on the long flights or do not have ability to exercise. These blood clots can be a significant problem. So one has to be very, very careful about. These blood clots are not only the blood clots that we know of, that they tend to happen in the legs or the blood vessels of the legs and then go to the heart. These are small blood clots which are invisible sometimes and can cause organ damage. So who are the high risk group people who have to pay a lot more attention? Obviously, unfortunately, women are again targeted more than men to have post-COVID conditions. Why is that? There are a lot of hypotheses. Nobody really knows, but the numbers show this. So this is just based on the luck of draw who has the larger number of long COVID. It singles out women at this point, at least. There is no racial difference, no ethnicity, one more than the other. Somehow the people with bisexual and transgender lifestyle preferences are more likely to report, whether they have higher incidence or not, but they are reporting it more to the authorities. Adults with disabilities are more likely to report post COVID-19 condition. Maybe underlying disability has something to do with it, but we don't quite know at this point. But these are the identified groups. Who could develop long COVID other than the high risk group? Most people we know that we will recover from 4 to 12 weeks. A few may continue to have symptoms even after the first part of the illness is over, and regardless of the severity of the illness. So somebody had bad case of COVID does not mean that they will get long COVID. They may just walk away from it. And somebody who was just infected or didn't even know they were infected can have really serious long COVID. Including the people with no underlying health conditions, so you're perfectly healthy, but not taking any medication and so on. Young and otherwise healthy family people, and even those with mild infections can be affected. So everybody is at risk as the pandemic does not spare anyone. People who survived the intensive care unit. I apologize for showing this slide, which is not the most pleasant slide I have showed to people, but they come up with additional neuromuscular weakness and become disabled for a long time. They have post-traumatic stress disorder. We all have heard about PTSD. Anytime you go through a major illness, major event, especially the negative event in life, it will haunt you during rest of your life. Whenever you are vulnerable due to a second event, all the memories will come back and will hurt you a lot more emotionally, sentimentally, and psychologically. There is this syndrome which is called the post-intensive care syndrome, and this is a new syndrome and then presents with different things. We'll briefly talk about it. Hopefully not many of us will suffer with it, but it can present in conjunction with the PTSD. And of course their management, as you would expect, is going to take a lot more complex approach for treatment and management than just simplistic view. As I said, that they have overlaps symptoms. So there are physical impairments, there are mental health problems, there are cognitive impairments, and not only that, we have all experienced that if a family member was admitted in the hospital, family was not allowed to visit for obvious reasons. That was extremely stressful for the families not to know what's going on. The doctor will call maybe one time in the morning, other time in the afternoon, and give you limited information because either they are going to be on the phone or taking care of the patient. Well, guess what the preference would be. So information that was coming to the families was very negligible and not enough, and left many families totally unsatisfied with what's going on with their dear ones. And when they are facing the fatal disease, unfortunately, it was very difficult. So family members do have ongoing mental health problems that cannot be ignored. You all and we all have who work in the hospitals during the pandemic have seen what I have shown in these two photographs, that we celebrated how patients survived. And then reunions were very emotional. Okay, so what are some of the signs and symptoms of long COVID? Everything that listed on this slide, I will probably, in the interest of time, not read, but some of these symptoms are a lot more common than the others and are written off by everybody. Oh, you will be fine. Fatigue, just the generalized malaise, fatigue. I just cannot get out of the bed. I need to lay down for 15 more minutes. Shortness of breath, things that you were able to do without any difficulty, climbing a flight of stairs. Now 1/4 of the flight, a half of the flight of stairs, you have to stop for a few seconds. That few seconds is a very big signal that something is going on. Difficulty thinking or concentrating, which is now given a word or a name, brain fog, is like you are in twilight zone. Headaches, different sort of headaches, spreading from just what would qualify as tension headache to the migraine headaches and so on. I already talked about with minimal effort, person is feeling tired. Chest pain is a serious symptom. Heart palpitation is a serious symptom. Sleep disturbances, mostly insomnia is very, very common. And then we have talked about different depression, anxiety, and joint and muscle pain. So some unique symptoms could be long-lasting sore throat, which will not improve. Change in taste or smell that we have heard so much about the acute COVID. Nausea, vomiting, diarrhea, feeling lightheaded, just like that. I'm sitting, getting up, and I feel lightheaded. That's a big symptom. Changes in menstrual cycles, very non-specific, skin rashes moving from one part of the body to the other, and hair loss. There is something called post-exertional malaise. It's the new diagnosis coming up now. Minor physical or mental exertion. So you are reading a book and then you will feel exhausted and tired, typically worsening 12 to 48 hours after activity and lasting for days or even weeks. You cannot recover from a small task you were doing. Now, it all seems like, no, this is for somebody else, this is not for me. Well, believe it or not, we all are in the same boat. It is just a matter of time when we will feel that something is wrong. Okay. I apologize for this slide, very busy, but just to show you the incidence. Here at the bottom is the percentage of the symptoms, goes all the way to about 75-80% of the symptoms, shortness of breath, etc. We should not be reading, but there are things like coughing of blood. Only very few, but it's still 5% of the people who have long COVID can cough up blood. That's a serious symptom, and we will go over what we need to do when a situation like this arises. Everything in between. Look at the post-nasal drip. Nearly 40-50% people have just runny nose, and that will continue. So these are just some remarkable symptoms, and there are studies after studies now coming out. Patients complain, I cannot do any exercise. My heart rate goes up very quickly and I get short of breath, or I have not had strength to return to physical activity. I did work in my house and 2 days later I had fever again after being 12 days fever free. I'm trying, but my lung capacity is still so low that just walking has me gasping for air. The one time I tried to do regular exercise, I was too out of breath after 1/4 of my usual time, so I stopped early. That was probably 3 to 4 weeks ago. So this is the kind of complaint that will come in to the provider, and if provider is not sensitive enough, they ignore it. And that dismissal is not acceptable any longer. How do we diagnose post-COVID syndrome or long COVID? The diagnosis is based on reported symptoms. There is no test. There is no thermometer. There is no tools that will measure and somebody will say you have long COVID. One has to pay attention, and we as the patient have to be able to tell and narrate what we know, that what is wrong. So everybody knows what is wrong, but you have to sometimes think about it and put words to it. That I know something is wrong, but I don't know what is wrong with me. Well, think and write it down, what is wrong with you, or just write what you feel. So try to use language and put words on it before you pick up the phone and call the physician. History of known COVID infection. Many long COVID symptoms are common in other health conditions. So I have history of asthma and I have new onset asthma and I'm wheezing. Well, I have to say that, I never had asthma like this. My symptoms were once a month, and now I'm getting daily symptoms. There is a change. If experiencing symptoms for the first time, the cause may be long COVID. Somebody starts wheezing, and I'm just using it as an example, but never had any history of asthma or anything. They may have new onset asthma because of long COVID. Provider may order tests to see if there is any impact to the lung, heart, or kidneys, which will qualify for similar changes in long COVID. But the tests are not required, as I said, to make the diagnosis. Diagnosis requires low threshold on the part of the provider, regardless of what system they are working for. So CDC says what workup. Okay. They have these categories of the liver, of the kidney test, liver test, markers of the inflammation in the body, thyroid test, vitamin deficiencies, especially vitamin D. If you remember, vitamin D deficiency used to be or is a risk factor for catching COVID, serious COVID. Rheumatologic conditions, which are musculoskeletal, connective tissue and joint conditions, hematologic, blood-related disorders, coagulation problems, cardiac problems like myocardial injury, inflammation of the myocardium or the layers of the heart muscle. And then it becomes kind of, you have to differentiate whether it's the lung which is really causing the problem or the source of the problem is in the heart. And there are tests that you would do and which will guide your provider to decide which way to go and what the further testing that we have to do. So there are these clinical features which actually warrant further evaluation. And these clinical features, we have repeatedly talked about the cardiac features. And I'm sorry, these are all medical words. And instead of just saying that, I'll explain what all these conditions are because this is not all inclusive. But if you feel that there is something wrong with me, my heart, I'm having palpitation, I get short of breath, I have chest pain, that could be your heart. And that's how we have to look at lungs, just the shortness of breath, cough, those kind of things. I cannot lay down flat. Kidney disease, change in urine volume or color or frequency. There are a lot of symptoms that you will feel that this is not my regular behavior. Losing hair, skin rashes, we talked about, muscle pain, fibromyalgia, trigger point pain. So you push at certain points in your body, on the shoulders, etc., and muscle hurts, not to go away. It's just keep doing it day after day. You may have a development of a rheumatologic condition. Diabetes, we all know those symptoms. You're feeling thirsty, you want water, called polydipsia, polyuria. You have to go to the bathroom so many times, wake up at night, called nocturia. 2 to 3 times, 4 times you are waking up going to the bathroom could be a sign of high blood sugar in your blood. Not necessarily diabetes. Remember, it could be high blood sugar and could be something modifiable. Neurologic, we have talked about, that we cannot have a sense of smell or eating and things like that. So there are, of course, the brain fog and the memory impairment, to mention a few. More depression, more anxiety. I would suggest that it should not be hidden. It should be talked about and with the friends, family, and the providers. Hiding is going to hurt you in the long term. We already talked about blood clots, incontinence, sexual dysfunction could point to urologic problems, unexplained weight loss, dysautonomia. This is a very important symptom. I like to spend 30 seconds on this. So you're sitting there all of a sudden at night, you're breaking out in sweat, or you are too cold, you put the covers on, you're too warm, you don't know where I am. That could be a sign of imbalance between your yin and yang, or sympathetic parasympathetic system, as we talk about. So those things are very important. Those symptoms are very important to mention to primary care provider. Now, if somebody is losing hearing or having dizziness, vertigo, definitely that is something to be brought to the attention of the provider. Okay, so how do we treat it? Well, sorry, there is no treatment, but can we manage it? Yes. We know a lot about it, that what's going on. So how to manage? Well, basic principles of management of these subspecialty organs, so heart, the lung, the kidneys, the liver, those specialties are out there and everybody is practicing them. That's exactly the management that we have to borrow from there and use for these conditions, at least until we know better. So our goal is decrease the severity of the symptoms, prescribe the treatments that are used to manage similar symptoms that happen after similar other health conditions. So somebody is wheezing, treat them like asthma. You know all about asthma, or if you are a cardiologist, if you are a rheumatologist, you are a general practitioner, internist, whoever you are, you will be able to take care of your patient. And I'm addressing here is to my physician colleagues and to my family members, friends, my audience today. I'm saying that insist that you can manage my conditions. You just have to put it into the right cluster and send me for consultation if you think that more consultation is needed, just like you will send me to a cardiologist if I have a heart problem. Follow that basic principle of practice of medicine. So referral to a specialist experienced in treating those patients with similar symptoms is very, very important. I came across a situation where a family friend called me and they were very frustrated because the primary care physician would not listen to them and they were just dismissing the condition. So I already said if the breathing is a problem, then your specialist will get some radiologic studies. They might do a breathing test. They may advise you to take part into exercise education program. We call it pulmonary rehabilitation. What it does is it makes you realize what's wrong. But more importantly is it gives you your limitations, how much you can work and not overdo it. Because when we try to do something, we cannot accomplish it, we feel very frustrated. That causes anxiety, that causes depression in the long run. So the most important part then is to accept what we can do and then plan our day, plan our time until things get better. Within those, we call it exercise prescription. So during this pulmonary rehab process, not only you can see people are working with dumbbells, somebody is on oxygen, some exercise is going on, and this is guided exercises and designed to your limits of functioning. So we will do that. And so referral to a pulmonary exercise program. MD should refer patient urgently to the specialist for life-threatening symptoms. That means if somebody is having chest pain, you suspect they are having heart attack, we don't have to sit there. We already talked about the test, even psychiatric problems. Somebody is suicidal, you're not going to wait for a referral to be approved by the insurance company. You need to call the crisis center and send your patient, and the patient and the family have to realize that this is a crisis and seek and ask for that help. So it has to be bilateral approach, then only this will work. Okay, then we talk about the medical management of the post-COVID-19 conditions. We already talked about optimization of the function, but also the quality of life. That becomes very, very important where we are. We already talked about enough about the specialist, and the transparency is very important in the process of goal setting. That what you know, share. What you don't know, tell them that you don't know. But I'll not give up on you because I don't know. I'll still work with you, and we will work as a team to get you through this. And that should be the goal of good quality care. Here's from CDC. These conditions are not yet well understood, and assure them that support will continue to be provided as the new information emerges. And believe it or not, there are so many studies going on. We will learn so much about these conditions, and hopefully we'll find a good cure. Symptoms which are not explained by or out of proportion to objective findings are not uncommon after COVID-19 and should not be dismissed. So I just have subjective feelings. I just gave you the example of sweating at night, feeling cold, feeling warm, and not know what's going on. That's a subjective thing for somebody because they are not seeing you. It's not an objective finding. That must not be dismissed. If patient says, I'm short of breath, you better believe that they are short of breath. Okay. There are certain very significant conditions that are now being clustered and found in this situation of post-COVID-19 syndrome, long COVID. Muscle-related problems, brain-related swelling and inflammation problem, what's called the chronic fatigue syndrome, So just continuous tiredness, fibromyalgia, I talked about trigger point tenderness and pain, stiffness of the muscles, something that will have symptoms consistent with Lyme disease like symptoms. Again, rashes and those kind of things that people get in Lyme disease. But this is not Lyme disease from the vector or the bacteria. It is just because of the virus related, which is presenting as Lyme's disease. We already talked about this dysautonomia, mast cell activation syndrome. So you are itching, you are having welts and the swelling and on the skin and itching, and you need antihistamines, etc., to stop this process. And then, of course, follow-up visit should be every 2 to 3 months to continue to follow and not let you out of sight if you have that symptoms. What's the role of vaccination? Vaccination may help alleviate the symptoms of long COVID. So people who are vaccinated may have less symptoms, but studies are still ongoing. Juries is still out on that. Vaccinated people are less likely to get COVID-19. So that's the good news. Even if they do get COVID-19, they will not have long COVID-19, hopefully. It's less likely, it's not 100%. Vaccines are recommended for people who have tested positive for COVID-19 in the past. So the immune antibodies that we develop with a natural infection, although they are called very, very powerful antibodies, etc., but they are not longer less lasting than the protection and the antibodies that we get by the vaccines. So vaccine is definitely desirable. There are these specialty clinics. This is the team specialty clinics now in the tertiary care centers where they have patients who are developing long COVID and they are discharged from the ICU. And they have specialists listed here, and then other specialists and support services that are needed to take care of these patients. People who are not admitted in the intensive care unit and are lucky enough to go to the hospital or stay home and get better. And here is the list of those. And you will notice that these people are the same specialist and support services, just a little random order has changed. Okay, and this COVID-19 core care team really has to improve your physical functioning, cognitive functioning, the brain fog, etc., and mental health, which we should not ignore at any time. So these services are building up slowly. They are not available everywhere. Even in our local areas, we have to be innovative in order to put together these services. And if we can call on what everybody is here in our town also, you will find every specialist that is listed here. So not necessarily they could be found at one place, but we can definitely consult with them and can have an interdisciplinary approach to the patient care. Okay. This is something I debated whether I should include or not. There is a bill in the Assembly and Senate, and both Assembly and Senate have passed this bill that the doctors who spread false information about COVID-19, whether it is related to the disease itself, whether it is related to the vaccination, they will be charged by the Medical Board of California and can be punished. And the bill is still sitting, and there are both sides, and it has the good side of it, the bad side of it. People are talking about freedom of speech and things like that. Other side is spreading the information is harmful to the public health. Whatever it is, I think September 30th is last date when the governor is going to sign this bill, and whether he will veto or not. But this will have a significant impact on the practice of medicine starting in California, and we'll see which way it goes. There are, in last few slides, I'll have self-care guidance. People with long COVID who experience worsening of symptoms after extreme exertion. you got to really figure out how to pace yourself for daily activities. Limit the stress, prioritize taking care of both mental and physical health, rest, relax, entertainment, friends, family, uh, parties, I don't know. Whatever is your cup of tea to give you mental peace, relaxation, please focus on that. And of course, little bit of exercise as much as you can do to have your physical health in order. Diet, nutrition is equally important. We have had many talks in this forum, and all those YouTubes are available for you to refer back or call one of us. We'll be definitely able to help you guide in one direction. Any symptoms that are limiting ability to return to uh, usual activities, seek the help of your healthcare provider, whether they are professional, corporate based, or non-profit based service organizations like American Desi Society. So there are some action items. Call your healthcare provider. Be prepared if you still have symptoms 4 weeks or after the infection, up to 12 weeks. They can help you manage the symptoms, and they will refer you, ask for reference if you think that additional care is needed. Do not assume that new symptoms are related to long COVID, because they may not be long COVID, and you'll get anxious and frustrated for no reason, because you may have just your asthma is just acting up a little more, and that needs to be taken care of, not necessarily you have long COVID. So you really have to weed out where we really truly stand. Seek immediate care if you have some of these serious symptoms, and I'll read them verbatim. Sudden and severe shortness of breath. The sudden and severe shortness of breath can point towards the blood clot going into the heart and compromising the flow of the blood into the heart. Okay, it's called pulmonary embolism. Chest pain, it could be cardiac issues, myocardial infarction, angina. Suicidal thoughts happens. People have been isolated. They are anxious, depressed, financial problems, family problems, social problems, everything can perpetuate suicidal thought. Don't have to fight with yourself. Seek help. Coughing of blood, called hemoptysis, is a very serious symptom, and can be a sign of multi-organ system involvement, something that cannot be ignored. Severe headache can point to simple headache, tension headache, but could also point to a situation like a stroke. Weakness on the one side of the body, or slurred speech. We all know from our common sense education that this is a sign of a stroke. So if any of these symptoms happen, do not hesitate to seek help and get help immediately. Do not leave a message and I'll call you in the morning kind of thing. Okay. There are support groups. I have a number of them here, which are on the CDC site, Body Politic. Link is here for the patients who have COVID-19. A lot of good information and resources are here. You would like to hear from the people who have the similar symptoms like yourself. There is survivorcorpse.com. This is another one, a good one, which goes into also medical research, what is coming down the pike, information, very informational group. There is a longcovidalliance.org, and so they are providing the similar kind of services. And there is one group out of England, I believe, for children. This group is also free and available for the information and support services. So we should know about these. We should spread the word, provide the link to this talk, or even you can Google and go to CDC website. There are hundreds and thousands of resources right now where we can find information and guide people to seek help with these groups. So last but not the least, now the long COVID is considered a disability, As of July 2021, it is known as post-COVID condition and is considered as a disability under the ADA. There are all the acts and titles which are exercised, and then this is in play. Last month, I gave long-term disability to one of my patients, and I was very proud of myself that I was able to help, because disability is a process that many physicians tend to shy away because of the paperwork that is involved. But I think this process is curtailed to just few forms and sending the copies of the medical records. So some of the review points: post-COVID conditions can include a wide range of ongoing health problems that can last for weeks, months, or longer. We really don't know. Post-COVID conditions are found more often in people who had severe infection or anyone who has been infected with the virus, whether they know about it, whether they tested positive or not, can experience COVID-19 conditions, long COVID. Patients who had, or people who had mild illness or even no symptoms, as I said, unvaccinated, non-vaccinated, people who have not accepted the vaccination, whichever way you look at, they are at high risk. Most people with post-COVID-19 conditions have evidence of infection, but in some cases, people have even not tested positive for the virus and did not even know that they were exposed or infected. But in pandemics, all bets are off. Everybody's at risk. CDC and other organizations are working to understand more about who experiences, and there are studies now looking at some of which that we reviewed, that what are the groups which are disproportionately impacted by long COVID and are continuing to be high risk, and we'll learn more and more. So thank you, and stay safe for listening to me. Thank you, and as I say, your safety is your own responsibility. Stay safe and do everything to keep yourself healthy. Thank you so much for listening to me, and I'll take few questions in the remaining time.
I have a question. This is Aruna. Hello, Deepak.
Please go ahead. I'm listening.
My question is that how many boosters you can take after taking the vaccination?
Okay, so if you have your what is called primary vaccination, is your first shot and the second shot, everybody got the third shot. The fourth shot is available, and they are giving it to the high risk population. Your provider will be able to get you the fourth booster. There is talk going on from the authentic sources that we will probably need booster. We don't know the frequency, whether it's going to be every 6 months or whether it's going to be once a year. They are also coming up with mixture of vaccine with flu vaccine. So again, there is no one single answer for that. As the new variants are coming, we are learning more and more about their involvement of the community, how they are affecting the community. The frequency we will know. But if you had primary vaccination, you are reasonably safe. If you have third, which will be the first booster, the third shot, that was very, very good. Not everybody has received fourth shot, but it is recommended for high-risk people.
I did receive the fourth one. Even after that, we both got COVID.
Yes, because
Unfortunately.
yes, because the vaccines are designed based on the probability, that the probability of what infection you have. So now they have B 4.0 or B 5.0 and all these little variants, little permutations, and it's again, which way the chips fall when you get infected. The bottom line comes to, if you are vaccinated, your illness that you will face because of the infection is likely to be, I should say, time limited, if not symptom limited, but will protect you hopefully from getting admitted in the hospital or getting so sick that you end up in the intensive care unit.
Okay, thank you.
Thank you, Deepak Bhai, for a very nice presentation. Because you would like to finish it in time, I have a quick two-part question.
Yes, sir.
After how many weeks or months of acute COVID can one say that the symptoms are not likely to be due to long COVID, number one? And number two, if you do have long COVID, are you a candidate for immunoglobulin therapy if you have
Okay.
severe symptoms?
Though the answer to both questions is no one knows, and yours truly definitely does not know. The reason is that after the first question, there is reasoning behind the answer. The reasoning is that after what point, so let's say 12 week, we heard during the discussion that 12 week is the high limit of symptoms, and if they continue you qualify for long COVID. But in the same breath we are saying that it could be just the exacerbation of your underlying hidden disease. And I gave you an example of asthma, that let's say somebody was supposed to get asthma 10 years from now, but because they got COVID, now that asthma has become evident. So that asthma will continue. So there is no way that we will be able to predict. That's an excellent question, but that is something that we probably have to wait, Dhiran bhai, for years before we will get an answer to that. So that's the first part. The second part was, uh, if you can rephrase or repeat the question.
Antibody. Are you a candidate for antibody treatment if you have severe long COVID?
Okay. So yes, it has fallen out of favor, and not many people are using it. Having said that, I have heard that it was used somewhere in East Coast recently, and it was effective. But again, as I showed you that slide with the Assembly and Senate bill pending, at this time, I would refrain on making a comment about a therapy which is not yet approved by the FDA and
Got it.
is not supported by the clinical evidence.
Thank you.
You're welcome, sir. Well, I'm very, very grateful for your patience and listening to me today. Would like to also thank American Desi Society profusely for giving me this opportunity and offering us a platform so that we can provide some public service. And everybody has a wonderful evening tonight. Stay safe, please.
So at the request of the Deepak Bhai, today we are going to conclude the program at this point. If you have any significant question that you would like to ask him, I'm sure you can contact him. Thank you very much for attending.
Thank you.